Hi, my name is Dr. Doolittle. I'm going to be showing you how to do a TMJ release. So first of all, let's check out the anatomy of some of these muscles that come around the jaw. So this TMJ is a very complicated little joint. It's actually two different types of joint capsules, and that's what gives us all the healthy motion of the side to side, up and down, and also protrusion and retraction forward and backwards. So this is what helps us to chew, and it's so important that we have a healthy TMJ for many different reasons. There are lots of little cranial nerves around this area, and those can be thrown off if we don't have proper healthy function, as well as it can contribute to headaches, to migraines, to a plethora of other neurological conditions. And not only that, but the actual process of digestion, and that includes nutrition absorption, begins in our mouth. So we have to have healthy chewing methods. So there are lots of little muscles, and that's what makes this joint very complicated to get a healthy release on. So we know that these little muscles around the TMJ need to be released, especially if we have TMJ issues. Of course, see your functional chiropractor and make sure that you've also gotten the adjustments that need to be done. But I'm going to show you the little release that you do on yourself. So what we are going to do is we're going to take this masseter muscle right here. We find it here's the ramus of the jaw, the corner of the jaw of this mandible. And we know right in there you'll find a belly of muscle that's called the masseter muscle. And I find it best if we just roll it around in circles. Rolling it in a circle is easier than pushing straight on it. It is going to give a little bit of pushback, especially if you do have some TMJ issues. You might feel a little bit of spasm. It might be tender. We're just rolling around in a circle. I love to tell patients always do both sides. Don't do one versus the other, because we want them both to be released and we don't want to release one over the other. So we're just rolling around in circles, and I'm pushing in with the tip of my finger, so I'm really getting a good motion on this. And what we want to do is we want to do about 30 seconds worth of masseter release, and then we can take a little break from that and go to the next muscle. So that's getting close to 30 seconds, and you'll notice that in the beginning it hurts worse and it starts to get a little bit less. If it's really bad spasm, then of course it's going to take a lot longer. So we do 30-second segments and then give it a little break because it is a little tender. Okay, now the pterygoid muscle you're going to find with the tip of your pinky finger. You're going to go inside the mouth, and then it's going to go up, and it's about this level. And the reason why is because it goes up from the bottom part of this TMJ and then around and through that center part. So we find it on kind of the back molar, the top molar, and you're going to just rotate up, and it's going to be a J pattern. So I'll show you what it looks like for me going into my mouth right there. So it's on the side right by that molar, and you're just going to roll along. You'll find it because it's a very small little muscle, but it's going to be a little contracted muscle. It's probably going to have a spasm in it too. It's going to be pretty tender. If you've had some chiropractic work done by me, you know I'll do the adjustment, and then I'll show you. I'll point out where that pterygoid muscle is. It's kind of tender, but as you start to get that release, and that's really where you're going to have fewer TMJ issues and fewer frequencies of this TMJ coming out of place. So we start that release on that internal part. Now go back and forth from your masseter muscle to the pterygoid, and it's just going to be about 20 to 30 seconds on each one, however long you need. I tell people to do it in either at night or in the morning, or you can do both. And it's really nice to just start getting in the habit of doing it around the time that you brush your teeth. So I hope that helps. That's your little TMJ release technique.